let's learn about the intravenous infusion therapy. Intravenous infusion therapy, that is giving fluids intravenously to patients not able to take it otherwise, is an integral part of care of many patients. The word intravenous literally means within. It also refers to IV therapy and it constitutes the administration of liquid substances directly into the vein and general circulation through venipuncture. The intravenous route is a fast and efficient method to administer fluids and medication, which can be given continuously or intermittently. Infusion therapy may range from mere measures to hydrate a patient to more complex administration during resuscitation and the administration of medication including toxic cancer drugs. Replace fluids and replace imbalances, maintain fluid, electrolyte and acid-base balances, administer blood and blood products, administer medications, provide parenteral nutrition, and monitor cardiac function. Veins are like arteries, and they're superficial and display dark red blood at the skin surface, and they have no pulsations. But tunica adventitia, which is the outer layer of the vessel, it is a connective tissue, contains arteries and veins supplying the blood to it. Tunica media is a middle layer. It consists of nerve endings and muscle fibers, and vasoconstriction response occurs at this layer. One layer of endothelial cells with no nerve endings and surface for plated. It's a surface of plated aggregation, and trauma and recognition of foreign object at this level. Phlebitis begins at this layer. Valves are present in most veins. It prevents the blood flow and pooling, and is more presently in lower extremities and longer vessels, and vein dilates at the wall attachment. Veins of the upper extremities include digital vessels like along lateral exposure of fingers, infiltrate easily, painful, difficult to immobilize, and should be on your last resort. Metacarpal vessels are located between the joints and metacarpal bones. They are formed by union of digital veins. Genetic patients often lack enough conduct or adipose tissue and skin turgor to use this area successfully. Cephalic veins start at the radial aspect of wrist, access anywhere along entire length. Medial cephalic vein are around the ramp to cephalic vein. They join the cephalic below the elbow stand, except larger gauge arteries, but may be difficult angle to hit. The purpose of the IV therapy is to provide parenteral nutrition, to provide avenue for dialysis, transfuse blood products, to provide avenue for hemodynamic monitoring, to provide avenue for diagnostic testing, and to administer fluids and medication with the ability to rapidly or accurately change the blood concentration levels by either continuous, intermittent, or IV flush method. Steps to start the IV is pre-cannulation, cannulation, post. Steps starting in IV is pre-cannulation, check the DR order, wash the hands, cut the equipment, access clamp, physical and psychological, explain the process to patient, select the site, select the needle, prepare the tape. Cannulations, vein dilatation of the tourniquet or thumb or cloving, then site preparation, needle selection, puncture the skin, enter the vein, flashback in the hub, remove the tourniquet, remove the needle, and connect it to vein. Open roll clamp, check for infiltration and IV flow rate. Slow rate, secure tape after transfer. Post-cannulation label date, time, initials on the catheter side and size. Remove gloves, calculate IV rate, client teaching and monitoring, and documentation. Like you can see from this slide, the technique tourniquet is applied and area is disinfected. Needle is introduced to the vein and blood is drawn into the valve. Healthy veins are round, firm, elastic, and engorged without hardened or bump. Areas to avoid the mastectomy, then edema, supravenous syndrome, then phlebitis, neoplasm, hematomas, and others. Equipment needed included the IV containers, administration sets, flow rates, IV stands, antiseptic solution, IV needles, tape, and side dressing. There are different types of catheters according to sizes of catheters according to the age. More than 1 year old is 20 to 24 gauge needle. 1 to 8 year old is 20 to 24 gauge needle. The same thing to wash your hands, then position yourself, locate a vein, place the tourniquet, ask the patient to open or close his fist or fist. Then place the limb in different position, apply warm, moist pack. In their thoroughly circular motion inner to outer. If the hair is hairy, then shave or clip the hairs and use the antiseptic solution agent. Hold the needle at the angle of 45 degrees with the bevel up. Pierce the skin immediately beside the vein you have selected. Bevel up and 15 to 25-degree angle to repair the skin and then lower the cannula. Then there is the tourniquet. Hold a catheter with your dominant hand, apply gentle pressure, and connect the tube into the IV tube and initiate the flow. Tape the needle securely with adhesive tape. Tape the needle and tubing in place with using paper technique, paper tape. Make a loop near the point of entry. Write the details of date, time, and the initial details, and adjust. Dispose of the equipment. Remove the gloves. Wash in your hand. Teach the patient about avoiding certain twisting, stretching, and try to keep the tubing from dangling below the level. Sudden change in the flow rate to the nurse, and nurses may need to show the patient how to ambulate safely with portable IV. Center of excellence device provides vascular access, short-term, long-term, increase patient comfort, increase risk of infection. How much times non-tunnel to peripheral inserted implant? Non-tunnel to fast insertion is bedside, usually polyurethane plastic, and a high risk of infection. PICC is inserted in peripheral vein and threaded into supraparenchyma. Long-term use can be done up to 6 months, smaller gauge than other, and dressing changes 24 hours after the insertion. Implant ports are placed into operating room, device completely under the skin, not just for venous access, but must be used to access by non-coring needles and long-term. Dressing procedures, the clear dressings used commonly should be used. If using alcohol and betaine, always use the alcohol first and use ointment only after the line is